Good afternoon. My name is Dominique Spears. I am a student at Cambridge College of Health and Technology. I am in the radiation therapy program. Today, my presentation will be about informing my audience about breast cancer and breast cancer awareness. Breast cancer awareness. Breast cancer awareness is important because it educates people the importance of attending breast screenings and detecting breast cancer as early as possible. Early screening detection of breast cancer is essential in management and treatment. Survival rates are improving in developed countries, but there still are a lot of improvement needed in poor resource countries. National Breast Cancer Month is in October. Everyone knows breast cancer month is in October because in the month of October, everyone wears pink. For the pink ribbon is an international symbol of breast cancer awareness. Pink ribbons and the color pink in general identify the wearer and promoter of breast cancer. In 1991, the pink ribbon were distributed to all breast cancer survivors and participants of the Komen, New York City race for the cure called the the Komen Running Ribbon, inducted by Suji Komen Foundation in 1982. What is breast cancer? Breast cancer is a cancer that forms in the cells of the breast. Breast cancer can occur in both men and women, but it's far more common in women. It is the most common malignancy in the United States. 1 in 8 women will be diagnosed with breast cancer. The direct of breast cancer is unknown. The direct cause of breast cancer is unknown. But there are risk factors. The risk factors of breast cancer, as you see, are radiation, alcohol can be a risk factor for breast cancer, liver dysfunction, estrogen therapy, obesity, and working a lot. There are different types of breast cancer, and the different types of breast cancer is adenocarcinoma, and the types are ductal carcinoma in situ, which is the most common, non-invasive. Non-invasive means it don't spread to other areas. You have lobal carcinoma in situ. In situ means in place. And lobal carcinoma are the type of cancer that starts and that forms in the lobes of the breast where milk is formed for breastfeeding. Invasive ductal carcinoma is the most common, and invasive lobular carcinoma is the second most common. All right. The symptoms of breast cancer and the signs are a breast lump or thickening that feels different from surrounding tissue. In order to early for early prevention in the early 20s, to find out if you have breast cancer, you're supposed to do at least a self breast exam every month, or usually when you get in the shower for women. And it's just when you just take your arm and put it behind your back and just do a little soft palpation around your breast. Another sign is a change in the size, shape, or appearance of your breast. Changes to the skin over the breast, such as dimpling, a newly inverted pimple, or peeling, scaling, trusting, or flaking of the pigmented area surrounding the nipple. Another name for nipple is areola or breast skin. Redness or peeling of the skin over your breast, like the skin of orange. And the skin of orange means, as you can see right here in a picture, is the tinting of orange, which is it's called pure PAU, pure day orange, which is a deadly type of breast cancer. And the pattern of spread that and breast cancer is when it spreads to the bone, lung, liver, and other sites. Another risk factor in regards to breast cancer is gender, aging, genetics, family history, race, and the race is higher in whites than in black, and because of that, the reason is because black women and the disease is more advanced because it's found later and are more likely to get a triple negative, which is a kind of breast cancer that is aggressive and comes back after treatment. Also, you got menstrual history, which they say that scientists say that females that start their cycle earlier, like around 12 years old, is more likely to get breast cancer in life because they have been more exposed to estrogen, and estrogen is the hormone that women carry. Alright, for just talk about some little family history here. You have two or more relatives with breast cancer or ovarian cancer, like females whose parents, like whose mom has had breast cancer, are more likely to have breast cancer as well. So they will become a higher risk since their parents have had it. A male relative with breast cancer, a family history of breast or ovarian cancer, and Ashkenazi Jewish heritage. Those are other risk factors. Right here, I have the treatments for breast cancer. The treatments for breast cancer are surgery is one, radiation therapy, chemo, and hormone therapy. And the type of hormone therapy that they usually do is tamoxifen, which is the main one that they use today. That's the main hormone therapy they use. Or they use androgens. Androgens is a form of hormone men have, which cause their hair to grow and all that. But they will use the hormone androgen to slow down the progression of the disease because it works opposite of estrogen. Estrogen is a hormone females carry, so they'll use androgen as a hormone to slow down the process of the disease in females. And like I was saying, that men can also get breast cancer as well, and the hormone they will use for men is estrogen because it works the opposite of androgens. Right here for men as well, the clinical presentation, which how everything looks like, the symptoms and the signs, which is the clinical presentation, is the same exact as women. So if you're a man, don't think you can get breast cancer, because you can, and it works. You get the same signs and symptoms as women do. And I have 4 signs here, which is a lump, skin dimpling, nipple, and retraction and discharge. For women that's at higher risk for cancer, breast cancer, for early detection, you should go get your screening as early as 30, because the normal screening for breast cancer is like between 40 and 50. So you need to get it early on, like around your 20s and 30s. Right here I have also the lymphatics, how breast cancer spreads through lymph nodes. And breast cancer spreads 4 ways through 4 different types of lymph nodes, which is the axillary lymph nodes, which is under the armpits. Then you have internal mammary, which is right here, and then you have the subclavian or the subclavicular as well. And most of the spread starts in the axillary nodes, which is under your armpit. But if you have a higher risk of metastases, they will take a biopsy of the sentinel nodes. That is how they find out if you have a metastasis of breast cancer. Right here I have some pictures of breast cancer. Right here. This more like stage 4, stage 4, stage 3, stage 4 breast cancer photos, which is pretty bad because most of these it look like the women may not have survived it. Like right here, seems like they would have got a lumpectomy. That means took the whole breast out. And that is one part of the surgery. One surgery that they would do, they would have a lumpectomy done, which will you remove the whole entire breast, or they have where you can remove the breast and the pectoralis muscle. All that because if it's test positive for any metastases. Right here, the survival rate depends on your race, your genetics, and how big the tumor is, and how much it has metastasized to other nodes in the body. And the overall survival rate for 5 years, 85%. That's with stage 0 is 100%, 71% after 10 years. So as you see, as the years go down, 5, 10, 15, 20, the survival rate really decreases. So you start out at 85 in 5 years, 71 in 10, 57 in 15, and 52 in about 20 years. But with stage 0, of course, everyone knows that's 100% survival rate. Stage 0 is more like in situ where it has a spread it. So, like if the breast may look normal, which is like when you test the cells, it may be well differentiated cells. Then you have stage 1 and 2 and 3 and 4 and stages. 4 different types of stages. And the way the stages are classified is through T and M, which means tumor, node, and metastasis. Tumor means size of the tumor. N means node, like in any kind of nodal spread, and metastases is in any kind of metastases, like spread to other parts of the body. Also, I have also they say that one case of breast cancer is diagnosed every 2 minutes in the U.S., which is a lot. Breast cancer in men, going back to breast cancer in men, gynecomastia is a form of breast. Gynecomastia is where men looks like they have breasts like women. And that's because of the hormones in their body. And also another cause for men is the Klinefelter syndrome. And there have been 2,000 cases a year, and so far there has been 450 deaths a year in men with breast cancer. And the treatment is the same: surgery, radiation therapy, chemo, or hormone. So far, like I said before, that the death rates has been declining due to better screening and early detection. And also going back to a link between breast cancer and estrogen is, like I said, women who had a cycle early on was at more high risk for breast cancer. Now, ways that you could prevent breast cancer are, maintain a healthy body weight, stay active, may exercise more, limit alcohol intake because alcohol is a risk factor, stop smoking, and avoid exposure to radiation and environmental pollution. Right here, you have my references were the CDC, MayoClinic.org, and WebMD. At this time, this concludes my presentation, and I want to thank everyone for listening. Thank you.